Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we talk quality of healthcare and explore what that actually means. Let's dig into performance measurements, the equipped platform, pharmacy goals, and personal goals. We will also occasionally cover topical healthcare news and maybe throw into the conversation a few of our own nerdy passions and hobbies. So turn us up. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. This is your host, Nick Dorich, and we welcome you to episode number 28 of the Quality Corner Show. Some of our listeners may have attended the PQA virtual meeting last week, and if so, you were able to learn from a great series of topics related to medication use, quality measurement, and population health. One such session included PQS's presentation, teasing our 2020 trend report. This highlighted some of our team's findings related to consumer perceptions of pharmacy, related to COVID-19 testing and treatment. Follow-up questions revolved around how pharmacy could shift its business model based on patient feedback and perceptions. For those who couldn't attend, we thought we might be able to elaborate more with the project leader, Todd Sega. Todd is the Senior Vice President of Development and Strategy at PQS. Todd, this will be your first time on the show, so welcome to the podcast. How you doing today?
Yeah, doing well. Thanks for the invite. Certainly have listened in on quite a few, so happy to be on the other side of this and join you.
Great. Before we dive into today's conversation, we like to get a little bit of background on our guests. So do you mind sharing your background and how you came to the PQS team?
Yeah, sure. So it's been a fun story. It's also a bit of a circuitous pathway to get to PQS, but I actually went to pharmacy school in Ohio at Ohio Northern University, and it was there that I had developed quite a bit of a passion for community pharmacy, also association management, and always had an interest in managed care as well. But while at school, we did not have an AMCP chapter, and we also didn't have a lot of connections to the payer side of things as well. But I always had that interest and kept in touch with some that I've met that were at the payer side of things and had a rotation with Kaiser Permanente out in Colorado. And so it was a little bit of jumping around, but I first started off in community pharmacy and then made my way into association management in Washington, D.C. at the Academy of Managed Care Pharmacy, where I worked in pharmacy affairs for a little bit. And it was there that I started to learn about some very niche areas that I certainly was not aware of while in pharmacy school. And some of those included partnering in a more effective and strategic way with a health plan with community pharmacies. And it was nice to have that vantage point while at AMCP. And some of those partnerships related to items that payers were accountable to or needed some assistance with. So that related to quality measures, specialty drug management, whether that's spend or clinical on the utilization management side of things, but also thinking a little bit more innovatively about how do we partner with other types of providers for specific areas like transitions of care that had high cost price tags associated with them. So it was there that it was a bit of a smorgasbord of different things that I was exposed to. And while at AMCP, I had an alert, and someone had mentioned to me that there was this new startup company called PQS, 3 letters standing for Pharmacy Quality Solutions, that aligned with pretty much everything that I had been developing quite a bit of passion for, which was helping payers better connect with community pharmacies and using or leveraging quality measures as a more objective way to assess and track that to show the value back and to see if progress is being made. So since then, I'd say it was history after someone told me about the position and the opportunity at PQS. So I moved from Washington, D.C. down to the Raleigh-Durham location where PQS was just establishing its first office. And so since then, it's really been history, and it's amazing that almost 6 years have flown by.
Excellent. Well, Todd, it's very exciting to have you on today's podcast. I know you're an avid advocate for public health and improving medication utilization. Your love for process improvement is perhaps only exceeded by your love of high quality coffee. So I hope you've got a great cup of coffee with you as we jump into today's conversation. Before we do, We did reference that we're going to be talking about the PQS trend report. So do you mind sharing just where folks can go to find that information, either the current report, but also perhaps some of the previous reports?
Yeah, sure. All of that is on the PQS website. So it's been on the front page, especially as we have updates to that report we have on the front page. So we try to make that easy for individuals to see that. But then we also have some other tabs on the PQS website. So you can see that there's a PQS news section. There's a blog that has highlighted some items with it, but then there's also a media and education tab where there's some additional content there that we have about the trend report. But typically, if you scroll to the very bottom of their homepage, you can see a link to the trend report at the bottom of our main page. So that's the easiest way to download it. And what's contained on that site is last year's trend report, which is the 2019. That was our inaugural report in pharmacy quality. And there are two parts to each trend report. Part one, which is typically more so survey-related data. And that survey data captures consumer perceptions, as I'd say section one within part one. Section two covers pharmacy readiness assessment for outcomes-based reimbursement or value-based reimbursement. And then section three within part one covers payer challenges and opportunities with performance improvement. That typically is released in the summertime. And then we do have a part two of each trend report, and that comes out towards the end of the year, and that contains a lot of data. So those are data-driven insights, and we typically have a theme with that. Last year's theme in 2019 were risk factors and associations with performance based on some social demographics for individuals. So there is some potential need for risk adjustment or what people would like to talk about that may impact the performance of the measure. So those are example data-driven trends and insights that we look at the impact of several factors on the measurement results. And that's part two. So 2019 full report is available now. And then what we also have as a little teaser that you mentioned earlier is a COVID-19 pre-release. So from the consumer perception, section one of part one, we released some of the responses and trends from consumers related to COVID-19 testing and treatment. And so we created that mini release, and that is also available on the website right now.
Great. Thank you, Todd, for that background. And, we're going to address our question one here, and whether we talk about it from a standpoint of this being a collaborative effort, or if we go with a different motif of Rome not being built in a day. I know that the trend report is something that you've thought about for a long time. It didn't just appear one day in 2019. Can you elaborate on the report and specifically kind of how it came about? What other hands are involved in the kitchen, if you will, to really bring this report to life?
Yeah, it has been a long journey to get there. And it was something that year over year, the interest to create a trend report really grew. And a lot of that interest grew out of the additional partnerships that we had at PQS, whether those were with community pharmacies, whether it's individual pharmacies, large organizations representing community pharmacies, or they were payers. And we started to hear some very similar trends, whereas pharmacies would say, hey, I can do all of these things, and we'd like to get paid for some of these additional services and show our value. And then we heard from payers that say, hey, we need some help in a lot of different areas, but we don't know who can help us. So there was a disconnect. And as we learned about community pharmacies that would approach payers, they seemed to have a different language than what the payers spoke, and vice versa. Payers would speak another language and it would just go over the top of the head of some community pharmacies, or they say, well, that's not in our lane. Here's what we can manage, and we can actually impact total cost of care, lower ED visits. And certainly those are items that are important to a payer, but each payer might be a little different for what challenges or problems that they are struggling with. So those were on the surface, some things that we observed where there just always seemed to be a disconnect from both parties as they had that conversation. And a lot of those conversations weren't relating to questions that were asked to consumers or patients. So we thought it would be really helpful to try and create a more common language between these groups and also not lose sight of patients. So that's why we always have a consumer perceptions part to the trend report so that pharmacies can learn about what patients are thinking is most valuable today that pharmacists have, and also what's most valuable in the future from their point of view. And then on the payer side, they're able to share and learn about patients, what they see as community pharmacy in the future. They can start to understand what community pharmacy is investing in and what they're saying that they're ready to step up and support. So it helps all three of those groups really learn from each other, but mostly for pharmacies to learn from consumers, payers to learn about consumers, and then payers and consumers to learn from each other. So we try to create that common language. You're right that it did create a lot of work. So we do have a committee that we had gathered to try and represent the different segments within the profession. And those included APHA, AMCP, NACDS, NCPA. We had several this year. We just added NASP as well for specialty pharmacy. And we did have PCMA, a representative from there as well. And then we had a couple of research partners that helped take us through it. So it was definitely a collaborative effort where we would come up with some drafts with our researchers of initial questions. And then we used a Delphi panel so that we had our full committee provide feedback on the questions that we would include for that. And we went through several rounds of that to get a consensus on the best questions, how to ask it, and what the response option should be, which then ultimately went out for survey implementation and data collection.
And so, Todd, I'll look to summarize the background here, and it's about the messaging that we share between pharmacies, between payers, between patients. It's about speaking the same language, and ultimately, we're all caring in some way, shape, or form for the patients, whether it's the patients or caregivers themselves, the pharmacies administering services, or health plans that are designing that plan benefit. So I think really the intention here is to create more information and to share it in a way that all groups can come together and utilize this to further change and evolve our healthcare. So we'll go into question 2, and Todd, you gave a background on the 2019 full report, which is available, and then talking about the 2020 report, and certainly that is having part of a focus on COVID. Can you tell us about the 2020 report and how it will be different when compared to the previous report, and maybe the topics that it's exploring? And as you referenced with the different groups that are involved, I'm sure they may have new topics that they're bringing up or that they would like to further explore. So do you mind commenting on that topic?
Sure. Yeah, it is different for a couple of reasons. One, it's different because of the new questions that we added related to COVID-19, but it's also different and very beneficial because of the year-over-year comparisons and trending. So that's where the power of the trend report starts to get more and more valuable as each year goes on, because now you can start to trend out how perceptions, whether they're from the consumer perception side of the trend report, or if it's among payers or community pharmacies, when you start to look at it year over year, you see how changes in behavior, comfort levels, and what individuals are investing in or saying they're struggling with is changing year over year. So that's probably first and foremost, I'd say the overarching difference with the 2020 trend report is truly just how you can compare and see how the trends are changing. But more specific to the podcast today, looking at the COVID-19 side of things, what's different this year is that we did have 2 questions added to the consumer survey. We did try to keep many of the surveys similar because then that's what allows you to compare year over year. But we asked these 2 questions, and one of them was if you suspected exposure to COVID-19 and rapid testing was available, what level of comfort would the consumer have? And then we presented 5 different healthcare treatment and testing setting locations for them to rank their level of comfort or to report how comfortable they would be with each of the 5. And those were community pharmacies with a drive-through, community pharmacies without a drive-through, and then hospitals, urgent care facilities, and primary care provider offices. So those were the 5 types. And the first question, again, was if you had suspected exposure and rapid testing was available, what would be your level of comfort with those 5? And then we also asked if you had a confirmed diagnosis and treatment was available, what would be their level of comfort with those 5 locations as well. So that was the brand new area that we added for the trend report this year as well.
Great. And Todd, when it came to COVID and some of the information that we had there, it was interesting looking through some of the initial results. It was talking a lot about access and some of the different services or comfort that patients had. Were there any main takeaways? And again, this information is all very early to see, but were there any items or responses that were perhaps surprising from patient responses in that information?
Yeah, there were. And I think for the listeners, it's probably helpful to understand some of the demographics and the context of the respondents and the size of the sample that we were working with. So we had a panel of consumers that we had surveyed, and they were across the entire country. So it wasn't as if this was a local panel, but they did include individuals across the country. They had to be 18 years of age or older at the time of completing the survey. And they also had to report visiting a pharmacy within the past 12 months. So because we're asking questions about pharmacy, we wanted to know that these are individuals who actually visit a pharmacy within a year. We ended up sending it to just over 2,500, it being the survey, and we got a total of 999, so just under 1,000 respondents, so about a 44% completion rate. And we collected other types of demographic information, such as gender, age, race, their insurance status, what region of the country they were located in, and also education levels, so that we can stratify some of the results to see if we had some interesting findings. And I will say that probably the first interesting finding was truly how comfortable consumers were with testing and treatment at community pharmacies. But there was a difference, and that difference related to the pharmacy having a drive-through versus pharmacies who didn't. And all of these were statistically significant as well. So what's interesting when you look at those 5 types that I mentioned to you in the question that we had asked, there was a difference in how comfortable the consumers were versus testing versus treatment at all sites except for hospital, and that's unsurprising. So the difference being consumers were more comfortable with testing versus treatment at all 5 of those locations except for hospital, where there was no difference. They were just as comfortable with testing and treatment at that setting, and that level was well over 80% of the consumers, so that they were comfortable or very comfortable with testing and treatment at a hospital. But for all others, urgent care, primary care, and then pharmacy with and pharmacy without a drive-through, there was a higher level of comfort among those with testing. And then when you compare with a drive-through versus without, there was also a pretty large difference there, where you can see individuals were more comfortable, or reported a larger percent reported being comfortable or very comfortable with testing when the pharmacy had a drive-through versus when the pharmacy did not. And that was roughly 12% higher percentage of the respondents rated a highly comfortable or very comfortable or comfortable level with testing at a pharmacy with a drive-through compared to those who didn't. So that's probably the first. There are probably some others that we could chat about, but that was one of the first takeaways, was truly just how comfortable they were, not quite as high as the other settings, but how important it is to think about supporting the testing capability with a drive-through, especially on these results.
Yes, that's a very interesting take, or just a tidbit of information from the report. And again, this is just a little portion of it, so we definitely encourage our listeners to check out the full report, understand some of the full context with that survey and the responses. Todd, we'll move to our third question, though, and as it relates to the trend report, we've talked in the podcast previously about pharmacist engagement as part of the healthcare team. And that's been part of the thought process as well with the trend report, other opportunities or other ways that pharmacists can provide services and be a member of the healthcare team. Can you help us explore some findings or opportunities? And maybe it relates back to the testing with COVID that you were just talking about. But what are other opportunities for pharmacists to consider patient care services? And what are other ways that people can explore how pharmacists can engage as a larger member of the healthcare team?
Yeah, I think a lot does report back from the trend report and some of the findings, and it underscores the level of comfort, especially when it comes down to the frequency of visiting the pharmacy and where we're at right now because of the pandemic. A lot of individuals are staying home, and despite some restrictions lifting, I think there will be a number of individuals, especially with some other chronic conditions, that may try to stay home longer. And that means that they might be canceling some of their preventative or follow-up visits with primary care unless it's urgent. But yet some may still try to make that visit with the community pharmacy, whether that's in person or, if available, which many pharmacies have stepped up to offer more capabilities for delivery, there's another touch point with the pharmacy, whether it be virtual or figuratively as they're dropping by their shipment. It's still a type of touch point with the pharmacist or the pharmacy. So in this time when we have less communication, unless it's through a portal, but some of the older patients may not leverage some of the portal systems, there becomes a large opportunity for community pharmacies to really partner with some of the prescribers and physicians and local offices to help talk about percentages of their patient population that have been tested, especially when it comes to vaccines, when there is a COVID-19 vaccine that might be available as well. There's a need to distribute information because the pharmacist is having that touch point and communicating more regularly with those patients, how to get that information back to the prescriber. So that's what presents as an opportunity for a community pharmacy to do a little bit more with the patient. And if they're administering a vaccine for COVID-19, well, let's look at the vaccine schedule. Is there another vaccine that the pharmacy can talk about with the patient to embrace that appointment-based model? Because this becomes even more important. You want to minimize the trips. What can you do during that appointment-based model if you're a community pharmacy to make the most of that particular service opportunity, whether that's vaccines or a comprehensive medication review? I think you'll see a lot of pharmacies start to think about being more efficient with the touch point, because every encounter matters, especially now when you know you may not have as many of those encounters.
Yeah, Todd, that's certainly a good point. There's a lot of changes due to COVID and how that has impacted our interactions. So there certainly will be a change with the pharmacy operations as well, and how pharmacy has that evolution. But again, I think this is all really good context, and there's a lot more that goes into the trend report. It's a pretty lengthy document, and the level of detail in there is pretty high. So I think it's a really good item that everybody can look into, whether you are a pharmacist, whether you're in health administration, whether you're working for a payer, or whether you're working for public health organizations. There's a lot of information. We'll get into our closing here. And Todd, I think this report has been very interesting, and the insights you've provided have been exceptional. If you had one message or one topic that you would like to see researchers, pharmacists, pharmacy teams, payers, if there's one item where you would like to see more exploration going into, I guess, what would be 2021, seems like that's a long way off, but it's really not that far off. What would that item be? What would be your suggestions, or what would be your call to arms for more information and more expanded opportunities?
Well, I think that's a difficult one to answer because there are a lot that come to mind. And this is a passionate area for myself, and I'm sure you as well. So sometimes it is difficult to pick a certain element, but timing is everything. And I believe now is the best time for community pharmacy and payers to think about breaking down some of the other barriers to data sharing in an appropriate way that supports accurate, reliable quality measurement, so that pharmacies can get a better understanding of the population that they're serving, what percentage of them have been tested, what percentage of them have received a vaccine when it applies, how many may have antibodies. As antibody tests become more and more accurate, that will become more valuable as well. So now is the time to really think about that pharmacy as the hub, or the pharmacy patient medical home, to think about it that way. So now is the time to really think about leveraging community pharmacy for more than just medications getting filled, but why not allow that as an opportunity for the pharmacy to discuss what their actual A1C test was? When did they last have a test if they happen to be a patient with diabetes? And what else can be done with that opportunity where the patient is engaged by the pharmacy that they can inform not only the prescriber, but also the payer that will certainly have challenges with data collection as well for some of their measures that they're accountable to. So it's really stepping back to break down some of the barriers that exist today and enable pharmacies to do more with those services, but getting more timely and accurate information. As the pharmacy has that, others are going to want and need that information as well. So pharmacies should be working very closely with their patients to obtain as much of that information as they're willing to share, because ultimately, as you have more information, you can help manage that in a better way, and that becomes more valuable. And then it underscores the value of community pharmacies and the whole value chain in healthcare as well. So I know it's broad, but that's probably the area where I'd strike to talk about timing being everything and how that time should be best used to try and create a little bit more of the pharmacy of the future that not only pharmacy wants, but consumers are seeing as well.
That makes me think about some of the comments or remarks that we see trumpeted about pharmacy, that being that pharmacy is the most accessible healthcare provider, or that it's the most convenient healthcare provider. They're in every community. And those are really more points about the location of the pharmacy and not actually the skill of the pharmacist. And I think what we're talking about is a shift from being talked about as the most accessible and most convenient, but talking about pharmacy and pharmacists being the most collaborative and the most utilized healthcare provider. So that is a big shift to get us there, but it does not happen unless we're having changes, unless we're having pharmacists that are really taking the wheel and pushing these patient care opportunities with their patients, but then also with the payers. And Todd, if there's any final thoughts here, would welcome that.
Yeah, actually, there's some of the results from the trend report reinforce that. So we stratified based upon some of those demographics I talked about. We actually stratified the level of comfort with COVID-19 testing by visit frequency. So we looked at patients who visited the pharmacy 3 or more times a month versus those who never go to the pharmacy or rarely go to the pharmacy. It may not be to pick up a prescription, but they still may go to the pharmacy to pick up some other over-the-counter items. But when we looked at those who visited the pharmacy 1 to 2 times per year versus those who visit 3 or more times a month, there was a much higher level of comfort with those who visit the pharmacy more frequently. So while part of that may be common sense, of course, they're going there, they're going to be more comfortable with it. I also tend to think that the more that they're interacting with the pharmacy, the more they start to see the potential and the more trust that they build in their pharmacist and the pharmacy team. So once the patients are in and have a frequent visit to the pharmacy, you now have an engaged patient, or more likely to have an engaged patient. And that's where the pharmacy can take that opportunity and turn it into something that they'd like for the future.
Thanks for the response, Todd, and we appreciate that you have joined us for this episode of the Quality Corner Show. It'll be great to have you on for another recording in the future. We also appreciate our listeners tuning into another episode of the Quality Corner Show. Hopefully you found this episode enlightening and informative. To summarize and where we'd like to make sure everybody goes to check out and get more information, since this was just a taste of the trend report, please go to the pharmacyquality.com website and look up the trend report. The full 2019 trend report is available now, and we'll be teasing out snippets of the 2020 report going forward. But we appreciate the time and your intentions and understanding how you can utilize this information for improving your patient care processes. This episode, however, has already covered a lot of material, and therefore it's time that we close out yet another show. Our team here at PQS has a couple of favors to ask of you, our podcast listener. First, we encourage you to share this podcast with 2 friends, because if you share this with 2 friends, each of them shares it with 2 friends, it really helps us hit a larger listening audience. Second, we also want to take a moment to remind you to subscribe to the podcast wherever you may find it. And then, if you have any questions or topics you would like us to address, please contact us. The best way to do so is to email info@pharmacyquality.com. Let us know what is on your mind and what we can address so that you are fully informed. Our goal is to continuously improve our podcast content and to provide meaningful information to our listeners based on the current topics in healthcare, technology, and quality measurement. We want to help you become as effective as possible in how you care for patients and improve public health outcomes. So until next time, we wish you well.